and welcome to my Pregnancy Fitness Diaries. Thanks for joining me. Today I'm going to be talking about pelvic girdle pain, or what's also known as symphysis pubis dysfunction, also lower back pain, and relaxin really. That's what I'll be covering today, as well as some exercises that can help with what you have if it's similar to what I'm suffering from, just a little bit right now. So late last week I had some lower back pain, and my chiropractor said that it's the sacroiliac joint which is causing the problem. So that's just at the pelvis where the spine comes into the pelvis, and because of the pregnancy hormone relaxin that's in your system while you're pregnant, the joints become a little bit more flexible. So my pelvis is widening just a little bit in preparation for childbirth. So yeah, so things are a little bit more supple and therefore prone to some discomfort. So to keep that under control, he's given me some exercises to do, and also I actually had to get a belt which straps right around my hips, a big Velcro belt. I haven't got it on me just now, but hence I'm moving like an old lady because there's pain. A belt which comes around here, basically keeping the pelvis compressed and a little bit tighter, so that it doesn't, on uneven surfaces and things, I don't increase the pain again. So that's something which I'll wear while I'm walking, not while I'm sitting, just while I'm moving and things. And I found that keeping moving really helps to minimise the pain. So as I sit, the joint compresses and kind of seizes up. So keeping moving has really helped. So the three exercises he's given me that I want to show you are, actually I'll show you two of them. One of the exercises is pelvic floor exercises, which I'm actually going to cover in my next video. So those are really important to do, especially later on from, I say, about 30 weeks in your pregnancy. But even from the very beginning, especially if you've had a child before and you've not done those exercises, it's really important to connect to the muscles deep down in your pelvic floor to make sure that they're well conditioned for before, during and after labour. So the first exercise he gave me is called the bird dog. Not sure why, but anyhow, starting in a tabletop position, keeping the tummy tucked in and the back quite flat here, so remembering not to drop and let the belly kind of weight drag you down. So from here, extending opposite arm and leg, reaching out, and then coming in, elbow towards the knee, and then down, and repeating that again, reaching out, reaching in, elbow towards the knee or more towards the bump, and then down. And the other side. As you're doing it, trying to hold in at your belly, also stabilising in the back will happen naturally as you're doing that. So reaching out, in and down. And if you can, and it's not too confusing, synchronise the breath with the movement. So inhale, reach, exhale together, and down, and starting your breath again. If you want to, it's also nice to do it in a 3, so you're going to go inhale, exhale, inhale, and down. And then you can naturally start with the breath again. Inhale, exhale, inhale and down. What's important to remember with this one is that you're not trying to kick the leg up high into the air. I'm not going to demo because it's not very good for my pelvis, but basically people sometimes kick the leg up instead of out, because you just need to extend forwards and backwards, really stabilising this. And what's funny is that I include this exercise in my core classes, and some people are like, don't really feel anything, but it really does work on a more subtle level than some of the ones that make you go, ah, my abs kill, wicked, really great workout. So this is subtle but brilliant. Another one he asked me to do was a bridge, which I've shown before, I believe, but obviously this is specific to the pelvis stability and stuff. So rocking the pelvis first of all, lifting up, lightly squeeze the bottom and then slowly down. That feels really nice, not painful on the back at all. Okay, so those are the two exercises he's given me, and I'm going to do about 10 to 15 of each exercise, each side on the bird dog, and 10 to 15 of those bridges. So like I said, the next video will cover pelvic floor exercises, which are really important. And just a little word on relaxin. So it's in your system from early on in pregnancy to way beyond pregnancy. So a friend asked me the other day, am I safe to do hip opening exercises? She'd had a baby in January and now it's June, and did she feel safe? Do I think she should be safe to do that? And I do think so. It's sufficiently long enough past having the baby that she can begin to stretch the hips a little bit. But you do want to listen to your body and be cautious, and she's right to be cautious about that, because relaxin, like I said, does stay in your system. And so if you're used to doing things like yoga, you don't want to overstretch and overforce yourself into things, because you might push yourself a little bit too far, pull something out of its kind of correct placement, like with my sacroiliac joint, and therefore cause discomfort. So just going easy with that, really. But otherwise, enjoy your training still. But if you have pain, I would really encourage you to seek it out, seek help out, because with my chiropractor, he's helped tremendously. I've seen him twice in the last week, just because the pain was so bad. I really was moving very carefully, and it's incredibly strange to have that. I've never had that before. So I'll stop waffling, but let me know if you've got any questions. I hope those exercises help you if you're having any pain in the pelvis area or lower back. But yeah, tune in next time for the pelvic floor exercises. Thanks for watching. Bye.